Hi, this is Dr. Bhargava. In this short video, I have a few interesting cases to share with you all. We will start with this FDG PET-CT study. This was performed to stage lung cancer. The lung cancer was histologically adenocarcinoma and it is not FDG avid, and that's okay. We know that lung adenocarcinoma is a histology that is not as FDG avid. The interesting finding about this study is that this patient has a left ventricular assist device. So we see the part of it here, and that we see this linear uptake along the drive line, and this is the site where the drive line is coming out of the patient. So on the coronal fused image, we find that that's the driveline catheter, and there is soft tissue thickening and focal hypermetabolism around it, seen right there, and that suggests infection. Since this opens into the skin, opens on the skin, this is predisposed to infection, and this was picked up incidentally on an FDG PET-CT scan performed to stage their cancer. Here is an interesting article on this topic, and the authors conclude that whole body FDG PET-CT identifies the extent of LVAD infection and predicts adverse outcome. These are two graphics showing different parts of the left ventricular assist device. So this is where we have the pump, and the pump gets the blood from the left ventricle and it pumps it into the body through this communication with the aorta. And here is the driveline. This is the catheter that was infected on our FDG PET-CT scan, and this is the site where it opens on the skin. So it's a tunneled catheter. This is the part that tunnels in the subcutaneous space before being attached to the pump, and this is at the site this is at the risk of infection. This is our next patient, and this patient underwent a VQ scan. The ventilation images using technetium-99m DTPA aerosol are displayed on the top. Perfusion images using technetium-99m MA are displayed at the bottom. And when we compare the anterior of ventilation to anterior of perfusion, we find that perfusion appears better. There is less heterogeneity. Same thing here when we compare the posterior of perfusion to the posterior ventilation above and perfusion below, we find that there is more uniform and better looking perfusion image compared to the ventilation image. And then on the posterior oblique images, we find that the pattern of perfusion is normal with good gradient from below upwards and from posterior to anterior. So this was reported as a low probability scan for acute pulmonary embolism. It turns out patient did have acute PE-like symptoms and presented to the ER. But on their CT-PE protocol, there were no new findings in the lungs. There wasn't a small pleural effusion that is characteristic of PE. We saw this large clot, and the borders of this clot are smooth, which is telling us that this has been there for some time. We see that the right ventricle is dilated. We see that the pulmonary artery is dilated. So this patient has chronic PE, and the VQ scan is negative. There is some literature that VQ scan is helpful in chronic PEs and shows fixed defects, but so far I have not seen one. And this was a chronic PE with findings seen on their CT-PE protocol, and the VQ scan did not show any fixed or reversible perfusion defects and was reported as a low probability study. So here is a review article on chronic thromboembolic pulmonary hypertension, pearls and pitfalls of diagnosis. And here they discuss the different modalities, including the CT and the VQ scan. This is our next patient, and they underwent a FDG PET-CT scan. We'll start by looking at the rotating image, and we find that there is this focus of hypermetabolism, which is very superficial. The history was lymphoma, and the patient's previous scan was negative for any hypermetabolic lymphadenopathy. This was a follow-up. We also find that they have a port in the right upper chest wall, and this incidental skin lesion is seen right here, low density focus attached to the skin and into the subcutaneous space. And so something like this is most of the times benign. It's an infected follicle or a sebaceous cyst, which is now called the infected epidermal inclusion cyst. So an incidental finding on FDG PET-CT, but should be not confused with malignancy. This is a good review article on benign cutaneous and subcutaneous lesions on FDG PET-CT scans. Thank you for watching.